The question is about VBAC, VBAC. The full form for this is vaginal birth after cesarean section. That means that the patient in her first delivery, she had undergone a cesarean section, and now in a second delivery, is it possible to deliver normally this time in a second pregnancy? There are two guidelines what doctors usually follow. The first guideline is that the reason why cesarean was done is not repetitive in the second pregnancy. That means in first pregnancy, example, the patient is having a short pelvis, a chota pelvis, जिससे baby doesn't pass. So that is a repetitive cause, because again in the second pregnancy she is going to have a small pelvis. So if there is a repetitive cause like that, then normal delivery is not possible. She has to undergo her cesarean section. The second rule what we follow is in obstetrics, present day obstetrics, any two complications always a Caesar. So if a patient of VBAC comes, I mean pehla delivery hai cesarean, she has already one complication, previous cesarean section. If she adds any other complication in that, like pregnancy induced hypertension, PV leak, then she has two complications, she has to go for cesarean. But if she has only one complication which is not repetitive, that is she has only one cesarean section and there is no other complication and no repetitive cause, yes, she can be subjected to a normal delivery in second pregnancy. So it is not like that if the patient has undergone a cesarean in first delivery, she will always go for cesarean in her second delivery. One thing has to be understood, that it is a complication in its own part, because cesarean section previously weakens down the uterus, and there is a chance that this previous Caesar ka scar may rupture, but the doctor who has a nice clinical judgment and can definitely understand when to stop this trial of labor in this patient. So it's basically up to you and the understanding and clinical judgment of your doctor to subject the patient to a normal delivery after cesarean section or not. But if you ask me about theoretical data, whatever I have already spoken about, it is possible.